Hello and welcome. This is a recorded training on the program implementation data requirements for grant partners implementing the Family Resource Center strategy. My name is Lisa Calling. I'm a member of the Research and Evaluation team at First Things First, and I will be guiding you through this training. Before we get started, I want to point out that this training is primarily designed for those individuals at your organization who are responsible for collecting and/or submitting data to First Things First on a quarterly basis as part of your contractual requirement to First Things First. After completing this training, if you feel like any of your colleagues who are working on this grant, such as any program implementation staff, would benefit from this training, please feel free to share this video link with them. This is the second of 3 required trainings for grant partners implementing the Family Resource Center's strategy. Because you are viewing the program implementation data requirements training, we anticipate that you have already completed the Introduction to Data Reporting Requirements training, which was also a required pre-recorded training. If you have not yet completed the introduction training, we will request that you complete that prior to continuing with this current training. The introduction training provides you with the context for why we collect implementation data, how it gets used, and the process for submitting data to First Things First. In the current training, we will review the specific program implementation data requirements that are required to be submitted quarterly to First Things First through the web-based Partner Grant Management System, which is referred to as PGMS from here on. As part of the RFGA process, you have already seen a list of the data reporting requirements for your strategy and the definitions of each of those fields. This training is a prerequisite to prepare you for the next live webinar training hosted by First Things First staff. The live webinar will include an in-depth discussion of any complex data fields for improved data accuracy and integrity to inform progress related to strategy implementation. It will also provide an opportunity for grant partners to get questions answered regarding data requirements, as well as to help you prepare to submit data that accurately reflects your program's implementation. Today's webinar will cover 3 topics. First, we will go over the purpose and specific learning objectives of this training. Next, we are going to take a broad look at the Family Resource Center's strategy and discuss how the data requirements align to the standards of practice for this strategy. Finally, the most in-depth part of the webinar will involve going through each data field required to be submitted through PGMS as part of your quarterly data submission. The purpose of this training is to help prepare you to collect and submit high-quality and accurate data that is in alignment with the data requirements for your strategy. The learning objectives of today's training are to support you in understanding the meaning of each of the data fields in your First Things First data reporting requirements and what each field specifically informs regarding your implementation progress. This data is also utilized towards ongoing regional and statewide strategic planning. Before we move into reviewing each of the data fields in your data template, I want to take a few minutes to provide a quick overview of your strategy's intent, the expected outcomes, and how the First Things First data requirements align with the strategy's standards of practice. Family Resource Centers serve as safe, accessible community hubs and provide flexible, family-focused, and culturally responsive information, resources, and services covering a wide range of topics. The intent of a Family Resource Center is to establish a community hub for families to increase families' access to concrete supports and services in times of need, to provide information, resources, and referrals, and to provide parenting activities. Family Resource Centers are a promising approach that is expected to increase knowledge of parenting and child development, parental resilience, connections between families and supports in their local communities, and children's social-emotional development. Family Resource Centers work toward creating environments that help increase protective factors, such as developing community connections, improving access to resources, reducing social isolation, improving parenting skills, and stabilizing families. Please note, you are required to adhere to all strategy components as part of your program implementation, but today's focus is only on the components that are aligned with the data requirements, which are the components highlighted in the red boxes, including referrals to services and parenting activities. All grant partners implementing the Family Resource Center's strategy must implement all strategy components. You must implement one or more of the 4 services required to be implemented as part of the parenting activities, including workshops, events, adult-child interactions, and/or community support group meetings. All services or activities offered as part of the Family Resource Center strategy must address at least one of the core topic areas that are listed in the standards of practice for this strategy. Some of the implementation standards that we're not discussing today will be captured in the program narrative report, which you will receive training on in the next live webinar with First Things First staff. Please refer to the standards of practice for the details on what each component entails towards successful implementation of the strategy. Additionally, please refer to your contract with First Things First to determine which types of parenting activities and/or topic areas the Regional Partnership Council intended to be delivered with your grant funding. Finally, before we turn to the data requirements, I want to take a moment to make you aware of some additional resources available to you that may support effective strategy implementation. You will find more information about your strategy on the First Things First website under the Strategy Toolkit. Once you are within the Strategy Toolkit, click on the Family Support link to take you to the FTF portfolio of family support strategies. There, you will see a link to the documents for the Family Resource Center's strategy that you must be in compliance with. For example, you will find the First Things First Standards of Practice, the Contracted Service Unit Guidance document, the First Things First Data Reporting Requirements and Definitions documents. The other critical document that you always want to refer back to is your organization's contract with First Things First, including your program's implementation plan. Here, you will find details on the Regional Partnership Council's specific scope of work requirements, such as the types of parenting activities or core topic areas to implement in your services, and the target population or geographic areas that the Council intended to be served with the grant award. Now, we will walk through the PGMS data template for this strategy. The next several slides will provide detailed instructions on how to submit the required quarterly data for this strategy. The data template for the Family Resource Center strategy has 6 sections. The first section is where you will report data on the referrals your program made during the quarter. In sections 2 through 5, you will report data summarizing the types of parenting activities conducted during the quarter. Some of you will only report data in some of these sections. It depends on the types of training activities that you propose to implement in your grant application to First Things First. For example, if you propose to conduct workshops and adult-child interactions in your grant application, you will only be required to fill out data in these sections of the data template. We will go over this in more detail later in this training. Finally, Section 6 is called Families with Children Birth to 5 Years Served, Beginning of Contract to Date. In this section, First Things First wants to understand the reach of your program, or how many unduplicated families and children have been served with the grant funding so far this contract year. An important part of the strategy implementation is being able to provide referrals to families for needed services. A referral is the process of providing direct assistance to families with the intent of linking that family to services based on an identified need. A referral to a service involves a meaningful conversation with the caregiver to discuss their concerns or needs. This may involve using guidance prompts, such as a list of informing questions to uncover needs, or it may involve a formal assessment. The result is providing the family with the help they need to access a service. The data requirements in this section describe the referrals made by your program during the quarter. In the first data field, count the number of families who received referrals during the quarter. Please note that you are counting the number of families here, not the number of referrals given, and that this is an unduplicated count, which means that you can only count each family one time, even if they received multiple referrals during the quarter. For example, you can see here that 5 families were given referrals during the quarter. Even though 2 of the families received multiple referrals, I would only report 5 in this data field. The next data field is asking you to count the number of referrals given to families with children birth to 5 years during the quarter in each of the categories listed. Please note that you are counting the number of referrals here, not the number of families receiving them. The definitions for each of these categories can be found in the First Things First Data Reporting Requirements Definitions documents, so I will not go through each of them here. However, I want to point out that the last category of referrals says Other. Please specify in the narrative report. If you enter data in this category, please remember to specify the type of referral that was made in the program narrative report for the quarter. You will receive training on how to submit data in the program narrative report at the live webinar with First Things First staff. In this data field, enter in the number of families that reported accessing one or more services for which they were referred. Please note that this is an unduplicated count, so if the same family reported accessing multiple services, or if they access the same service multiple times, you can only count them one time toward this total. Sometimes it takes longer than one quarter for families to follow up on a referral and access the services they need. It's perfectly okay to count any family here who accessed a service for which they were referred, even if the referral happened in a previous quarter. For example, this family received 2 referrals in quarter 1, one for nutritional support and another for educational counseling. The family reported following up with the nutritionist in quarter 2, so you could report this family in the quarter 2 data report. The family didn't follow up with the academic advisor until quarter 4, so you would report this family again in the quarter 4 data report because they followed up with a different referral. According to the First Things First standards of practice, when grant partners give a family a referral, they are required to make attempts to contact the family within 30 days to determine the status of that referral. This data field is prompting you to enter the number of families with children birth to 5 years who you were unable to reach within 30 days of providing the referral to services. In sections 2 through 5 of the data template, we will look at fields that detail different parenting activities that are designed to inform families of young children on parenting topics. First, we will look at section 2, which details workshops conducted to inform families of young children on parenting topics. Workshops are structured, interactive activities designed to inform families who are parenting young children on a parenting topic, which may be offered as a single session or as a series of sessions that are connected. The first question in this section asks whether you are contracted to conduct workshops as part of your grant contract with First Things First. If you're not sure, please refer to your contract with First Things First to determine the types of parenting activities proposed in your grant application. If you are not contracted to conduct workshops, select No. You are done with data entry for this section and can skip to section 3 of the data template. If you are contracted to conduct workshops, select Yes. You will then be required to fill out the remaining 2 data fields in this section. The first question you are required to submit is about the number of workshops conducted during the quarter and the number of duplicated adults that attended each of those sessions. The first step is to select the topics of the workshops conducted during the quarter. Each workshop can only be counted in one topic area, even if multiple topics were covered during the workshop. So, for the purpose of data reporting, be sure to classify your workshops by the primary topic that was covered. If you select the Other category, please remember to specify the type of workshop offered in your program narrative report for the quarter. The second step is to enter the number of workshops that were conducted on each of the topics you selected. For example, you can see here that I conducted 6 workshops on parenting and 5 workshops on health and safety. Finally, the third step is to enter the duplicated number of adults that attended workshops on each of the selected topics. As a reminder, this is a duplicated count, which means that you can take a head count of the adults in attendance at each workshop and report that total here. One of the simplest ways to track duplicated attendance data is by using sign-in sheets at every workshop. Simply count the number of adults in attendance at each workshop and report that total for each of the topics you select. Please note that the number of adults you enter for each topic must be greater than the number of workshops, or you will get an error message in PGMS. The last data field on workshops is asking you to report the unduplicated number of adults that attended workshops during this quarter. For example, if you look at your attendance sheets for workshops during the quarter, identify the number of unique adults that came and report that total here. The next section of the data template is on the parenting events that were conducted during the quarter. Parenting events are site-based or site-hosted informational, resource-sharing, recreational, and/or social events designed to raise families' awareness about a parenting topic or community resource. Some examples of parenting events are general information fairs, an open house or site tour, a water safety event, or an oral health event. The first step is to select whether or not you are contracted to conduct events as part of your grant contract with First Things First. If events are not part of your contract, select No. You are done with data entry for this section and you can skip to section 4 of the data template. If you are contracted to conduct workshops, select Yes. You will then be required to fill out the remaining 2 data fields in this section. The first data field is pretty straightforward. Simply enter the number of parenting events that were conducted during the quarter. Next, enter the unduplicated number of adults who attended the events held during the quarter. As a reminder, this is an unduplicated count, which means that adults can only be counted one time, even if they attended multiple events you conducted during the quarter. Section 4 of the data template captures information related to adult-child interactions conducted by your program during the quarter. Adult-child interactions are opportunities for parents, caregivers, and children to engage together in developmentally appropriate play and interactions that are designed to support parents and caregivers in learning about their child's age and stage of development. The interactions are facilitated by staff who guide and model positive techniques for parents and caregivers to practice with their children. The first step is to select whether or not you are contracted to facilitate adult-child interaction sessions as part of your grant contract with First Things First. If adult-child interaction sessions are not part of your contract, select No. You are done with data entry for this section and can skip to section 5 of the data template. If you are contracted to conduct adult-child interaction sessions, select Yes. You will then be required to fill out the remaining 2 fields in this section. In the first data field, simply enter the number of adult-child interaction sessions that were conducted during the quarter. Next, enter the unduplicated number of adults who attended the adult-child interaction sessions held during the quarter. Please note that this data field is unduplicated, so you can only count each adult one time in this total, even if they participate in multiple sessions during the quarter. Finally, enter the unduplicated number of children ages birth to 5 years who attended the adult-child interaction sessions held during the quarter. Similar to the last data field, this number is also unduplicated, so only count each child one time. Please note that adults and children are required to participate in these sessions together. This means that the number of children you report here must be greater than or equal to the number of adults, or you will receive an error message from PGMS. The fifth section of the PGMS data template is about the community support groups conducted by your program during the quarter. Community support groups are time-limited, topical groups or ongoing, regular groups facilitated by Family Resource Center staff, where families come together for the purpose of building a network of community supports and increasing social connections. First, select whether or not you are contracted to conduct community support groups as part of your contract with First Things First. If support groups are not part of your contract, select No. You are done with data entry for this section and can skip to section 6 of the data template. If you are contracted to conduct community support groups, select Yes. You will then be required to fill out the remaining 2 data fields in this section. In the first data field, simply enter the number of community support group meetings that were conducted during the quarter. Next, enter the number of adults who attended these meetings. Please note that this data field is unduplicated, so you can only count each adult one time in this total, even if they participate in multiple meetings during the quarter. Before we move on to the last section of the data report, I just want to spend a few minutes talking about how First Things First will use the data you submitted in sections 2 through 5 to calculate one of the units of service for this strategy. One of the units of service for the Family Resource Center strategy is number of parenting activities held. It is defined as the number of workshops, parenting events, adult-child interaction sessions, and community support group meetings conducted throughout the contract period. This is not a data field that you submit to First Things First. Rather, we take the data you submit in sections 2 through 5 and calculate this unit of service for your contract. Let's take a closer look at how your unit of service is calculated each quarter. First, from the data submitted in section 2, we add up the number of workshops conducted across all topics. In this example, there were 11 workshops conducted during the quarter. Next, we add in the 3 parenting events conducted from section 3, the 12 adult-child interaction sessions from section 4, and the 6 community support group meetings from section 5. Finally, we add up the data in each of these data fields to calculate the unit of service. In this example, all of the parenting activities added together equals 32 parenting activities held during the quarter. Over the course of the year, First Things First will continue to add up the number of parenting activities conducted and report these data in comparison with the number of parenting activities you are contracted to serve or your contracted service units. In this case, you can see that the 32 activities we just calculated is shown in quarter 1, and each quarter, new parenting activities get reported. By the end of the year, this adds up to 122 total parenting activities conducted during the quarter, which is very close to the contracted service units for this contract. In this last section of the data template, we are looking at how many unique families and children ages birth to 5 years have been served so far throughout the fiscal year and what type of services they've received at your Family Resource Center. This information will help First Things First and your organization understand the reach of the strategy to the intended families within the community. The intent of this section is to answer 3 questions. Since the beginning of your contract period, how many families with children birth to age 5 not yet enrolled in kindergarten have 1. Participated in a parenting activity, 2. Received a referral to services, or 3. Did both of these things? Please note that most First Things First contracts begin on July 1st and end on June 30th. Please refer to your contract to determine your specific award dates. Let's go through each of these 3 fields in more detail. The intent of the first data field is to see how many unique families have participated in the parenting activities that have been conducted by your Family Resource Centers so far during your contract period. In order to be counted in this field, a family must have attended a workshop, parenting event, adult-child socialization session, or community support group meeting that was offered at some point during this contract period. Please note that this is an unduplicated count, so if families participate in more than one parent activity during the year, they are only counted one time towards this total. In the example shown here, this family attended a workshop offered in July, a parenting event offered in December, and a community support group offered in January. Because this data field represents an unduplicated count, I can count this family in section 5 for the first time in the quarter 1 data report. However, I cannot add them again in this total when I report data in the quarter 2 and quarter 3 data reports. One way you can keep track of this information over time is to keep a spreadsheet of all the parenting activities you conduct and which families participated in those services. This spreadsheet assigns each family a numeric ID, which can help you keep track of each individual family's case file. In the column headings, I list all of the parenting activities that occur during the contract period. By looking at the sign-in sheets for each of these activities, I am able to identify the families that attended, and I enter the number of adults from that family that attended those activities. For example, I can see that 2 adults from the Irene and Dale Hernandez family attended the first parenting event conducted on August 1st, 2018. Keeping track of the data in this way will not only help you submit the quarterly data to First Things First, it will also prepare you to submit participant-level demographic information to First Things First on an annual basis. The next data field in Section 6 requires you to enter the number of families with children ages birth to 5 not yet enrolled in kindergarten who have received a referral to services at some point since the start of your contract period. Similar to the last data field, this field is also an unduplicated count, so you can only count families one time in this total, even if they received multiple referrals to services during the year. In the example shown here, this family received a referral to a medical provider in quarter 1, to AZIP in quarter 2, and to economic supports in quarter 3. When I report data in quarter 1, I can add this family to this data field. However, when reporting data in quarters 2 and 3, I want to make sure not to double count this family in the total. You can track the data on referrals in a way similar to tracking parenting activities. Another spreadsheet is shown here, which assigns each family a numeric ID to help keep track of each individual family's case file. In the column headings, all the referrals each family receives are listed, including the type of referral, the date follow-up was conducted, and the status of the referral. For example, from this data you can see that the Smith family was given a referral to active parenting the first 5 years on July 20th, 2018. When the Family Resource Center followed up with the Smith family on August 15th, they found out that the family was put on a wait list to enroll in the next time this series is offered at the Family Resource Center. Keeping track of your referrals in this way will not only help you submit data on the total number of families receiving referrals in Section 6 of the data report, but it will also help you keep track of whether families are accessing the services for which they are referred, which is a data field required in Section 1 of the data template. One of the units of service for this strategy is the number of families referred to services. You can find more information on the definition of this unit of service from the Contracted Service Unit Guidance document for this strategy. Although I'm not going to go into the implementation details for this unit of service, I want to point out that the data you submit in this field is how First Things First calculates this unit of service. Let's take a look at an example of how this data field is reported throughout the year. This slide illustrates how First Things First will take the data you submit in this field and report it to regional partnership councils and other internal First Things First staff during the state fiscal year. Each quarter, First Things First will take the number you submit and compare it to the number of families you are contracted to provide referrals to. Because this data field is expected to increase or stay the same throughout the year, the most recent quarter will tell us how close your program is to meeting your contracted service units. In the example shown here, we can see that this grant partner is contracted to provide 100 families with referrals. In quarter 1, they reported that 50 families received referrals so far during their contract. First Things First then takes this number and shows in the quarter 1 field of the data report. This happens throughout the fiscal year, so regional partnership councils can see the progress on the grant partners in quarters 2, 3, and 4. The last data field in Section 6 asks you to enter the number of families with children birth to 5 years of age who received a referral and who attended any parenting activity since the beginning of the contract period. This data field is intended to capture the unduplicated number of families that are receiving quality services from your Family Resource Center during the contract period. Remember that each family can only be counted one time, even if they attended multiple types of parenting activities, received multiple referrals, or some combination of both of these types of services. Since the start of the contract, i.e. July 1st in most cases, the unique number of families who received both a referral and attended any parenting activity. Do not count families who either 1. Only received referrals but did not attend any parent activities, or 2. Only attended parenting activities but did not receive referrals. If you are using spreadsheets to keep track of the families receiving referrals and the families attending parenting activities, all you have to do to submit data for this field is compare those two lists. The families that appear on both of the lists can be counted in this data field. The data you submit in Section 6 reflects the services you've provided to families since the start of your contract to date, which means that each quarter you are entering a cumulative summary of the services provided over the course of the contract year. The data you submit in this section should either increase or stay the same compared to the numbers you reported in the previous quarter. One way to check the accuracy of your numbers is to look back at numbers submitted in previous quarters and to ensure the current quarter's numbers are greater than or equal to those values. This slide depicts another way you can think about how the data in Section 6 will look over the course of your contract with First Things First. You will see we are tracking the 3 data fields in Section 6 over the course of the state fiscal year. You can see here that all 3 data fields are either increasing or staying the same over the course of the state fiscal year, which makes sense since more and more families are attending parenting activities and receiving referrals over the course of the fiscal year. Looking at your data in this way over time may help you to see whether the data you are submitting is accurate compared to the previous quarter and whether you are on track for meeting your contracted units of service for the number of families receiving referrals. Thank you for your time and attention today. You have now successfully completed the data requirements portion of this training, and you are all set to submit your quarterly data. In the last few minutes, we will walk you through the process of completing your data submission. After all the data fields have been completed, click Save. You may notice error messages which appear in red font. If you have errors, please fix them and click Save again. Your data will not be saved until you correct all the errors in the template. If there are no errors when you click Save, you are ready to submit your data. A friendly reminder, once you submit data, First Things First considers it a final submission. As such, please make sure that you double-check the accuracy of your data before submitting it to us. When you're absolutely sure that you're ready to submit your data, change the status of your template from In Progress to Completed and click Save. Once you submit your data to First Things First, you won't be able to edit it. If you notice you made an error after you submit, please see the Introduction to Data Reporting Requirements training for information on how to request a change to your submitted data. Now that you have learned how to submit your data, let's go over a few next steps. If you need help to complete this training, or if you have questions related to the content covered today, send your questions to First Things First via the email ftfevaluation@firstthingsfirst.org. And please make the subject line Family Resource Centers. We will review your questions and get back to you. We also encourage you to reflect on this training you took today as you prepare for the next live webinar with First Things First staff. For example, you may consider if something wasn't clear to you in today's training that we can help to further clarify, and who else at your organization or your subcontractor's organization might benefit from completing this training. You also might consider if your program needs to modify its data collection plan to ensure the data you submit to First Things First accurately reflects your implementation. Please continue to reflect on the training, especially as you prepare for the next training. If you are viewing this at the start of your contract period, your next training will be a live webinar with First Things First evaluation staff. The live webinar will include an in-depth discussion of any complex data fields for improved accuracy. It will also provide an opportunity for you to get your questions answered regarding data requirements. You will be receiving an invite to the live webinar shortly after the start of your contract period. If you have particular questions or topics that you would like to be included in the live webinar discussion, please email your questions to First Things First Research and Evaluation staff at ftfevaluation@firstthingsfirst.org. Make sure to include the strategy name in the subject line of your email. Please submit your questions at least 2 days in advance of the next scheduled live webinar in order to provide First Things First evaluation staff sufficient time for review and any follow-up. First Things First Research and Evaluation staff will be answering these questions during the live webinar. We would appreciate your feedback on this training so that we can continue to improve the training experience for our grant partners. After the live webinar training, First Things First will be sending an email with a link to a short satisfaction survey to the main, program, and evaluation contacts associated with your grant contract. We would greatly appreciate it if you could take a few minutes to complete this short survey about your overall training experience. Thank you for taking the time to complete this training. We look forward to working with you throughout your contract period.